I've really enjoyed using Presto. It's made me faster. It's decreased my fatigue at the end of the day. And I feel like it's the most important thing is I have more time where my eyes are on the image. All I've done is capture the screen. I haven't said a word. Probably a couple of days after that, I was using it 100 times a day.
Can you tell me about Evansville Radiology and your practice? For example, volume, case mix, and what a typical reading day looks like.
Yeah, so Evansville Radiology is a private practice group based out of Southern Indiana, 14 local radiologists, and then 12 teleradiologists and 4 nurse practitioners. So we're a very busy practice, but a typical day for me is reading somewhere between probably 150 and 250 cases. So busy day.
Okay. And can you tell us what was your reporting workflow before Presto and what frustrated you about the workflow?
Yeah. So probably 3 years ago, we were on PowerScribe 360, but we had transcription as our editor. So we were still using transcription essentially just in the setting of PowerScribe 360. We moved to completely to VR at that point and went to a more templated workflow. And for me, the frustration was the constant looking back and forth from the images to the PowerScribe window. The way I was trained, I was trained on transcription. So I was looking at the images the entire time. There was nothing to look at that point. And so when I had to shift to that, I noticed a few things. I noticed, increased just fatigue as I'm looking back and forth.
Great. And, can you tell us how did you get started with Presto and, what the initial setup was like for you?
I was introduced to Presto at the strategic radiology meeting in the vendor section. I just kind of was making my loop and stopped by and talked to the guys from HOPPR and really talked most about the Foundry at that point. But I did sign up for early access. And by the time I got home from the meeting, my early access was available. And so I just loaded the program. And the thing that was the easiest for me to understand was the screen capture. So I just got started and I started doing some screen capture and did that for about a week.
Your group actually moved from PowerScribe 360 to PowerScribe 1, which has, ambient mode built in. And so what was your experience with ambient mode and, how did you think about it compared to sticking with Presto?
Yeah, I was excited about ambient mode. I knew PowerScribe 1 was coming prior to being introduced to Presto. And so I was excited about ambient mode. But I had my training for PowerScribe 1 and the trainer told me ambient mode doesn't really work. So I said, your templates have to be perfect. They have to be named exactly right. I probably used it on 3 cases and it didn't even come close to working. It was not an option for me to use. It's just not a feature that's functional. The Presto findings is what ambient mode should have been.
Can you actually walk me through a specific case where Presto genuinely saved you time or effort?
Yeah, it does pretty much every case I use it on, but time and effort and sort of focus, I would say one of the key times that I see that is on an exam where I would normally have to scroll back to look at certain things as I dictate them. So a PET CT, a CTA runoff, a head and neck CT, where in the past I might look at a certain section, I might look at the vessels and then dictate the vessels, and I might look at the soft tissues and then dictate the soft tissues. Now I start at the top and I dictate as I go and I merge those findings. So if I see a bone lesion in the skull, I talk about it because I start at the skull, and then I may talk about a lymph node in the neck and a nodule in the lung and an adrenal nodule, and then another bone lesion in the lumbar spine, and then something in the pelvis, and then another bone lesion. Well, I can put those in a free dictation, and Presto will take that information and put it in my template right where it needs to go. I haven't once turned my head to look at the PowerScribe to see which field I'm in.
Actually, you are one of our highest volume users when it comes to Presto. And I know you mentioned the Presto Capture functionality before in the beginning. So how are you using Presto Capture for measurement heavy studies such as, DEXA scans and ultrasound worksheets?
Yeah, I use it on every case that has a worksheet. I use it on every coronary CTA, anything that's worksheet heavy or measurement heavy, every DEXA scan. For the most part, for the ultrasounds, it is the entirety of my report. So I highlight the report worksheet that the technologist has provided. It's going to have the measurements on it. It's going to have the tech notes on it. And so I'm going to screen capture that, and it's going to merge into my report. And while it's merging, I'm looking at the images to make sure that I agree with the sonographer's findings. If I don't, then I'll go back and edit them after. But most of the time, we have good sonographers, so most of the time I do agree with the findings, and so my report's complete. All I've done is capture the screen. I haven't said a word. I had a twin pregnancy ultrasound, and it was for anatomy, and those report pages are full of measurements, very complicated. So I put, baby A on one screen, baby B on the other screen captured the whole thing. Created the template, baby A, head maternal right, baby B, head maternal left, near the fundus. Everything subdivided, perfect report. Within seconds, I have the dreaded, twin pregnancy anatomy scan.
And would you say Presto has changed the quality or consistency of your reports and not just the speed?
Yeah, for sure. For one, when I'm not looking back, I'm back and forth at the PowerScribe screen. I'm not getting distracted. But also, it's decreased the friction for me. I think on busy days, we see certain findings and we're sort of on the fence whether we're going to talk about it or not. There's the friction of tabbing back. Oh, I saw that, and I'm going to tab back up to that field. It's like, do I really need to talk about it? It's one of those iffy findings, and now it's just easy. It's just easy to just talk about everything I see because I know I can say it, and then it's going to put it in my report.
And I know that you emailed your partners recommending Presto. What made you do that?
Well, probably two things. My partners are all friends of mine, and so I want that for them just as friends, but also, we're in business together, and I want them to be as efficient as possible too.
Now, switching gears a little bit, where does Presto not help? For example, what studies do you still do the old way?
Sure. Well, anything that's normal. I have templates that were blown in, and so I just sign. And then I think anything where there's probably one finding that's going to go in the body of like a plain film, but there's not going to be anything in the impression. So it's probably faster to make two tabs and dictate a short sentence, mild spondylosis of the L4-L5 level, and sign that time. But I think any time for me where the net gain of time is zero, I still use Presto, even if I think I could dictate it just as fast. At times a DEXA scan, if it's a very measurement heavy screen and the screen capture and the merge takes a little longer, I might be able to have said all those measurements in that same amount of time potentially, but I would have spent all that time tabbing, talking fast, things that in general just fatigue me when I do them over and over again during the day. Whereas, it's basically a time where I don't have anything to do if Presto's going to do the work for me. So even if I'm not gaining time, I still use Presto just because of the fatigue and sort of concentration factor.
Finally, would you go back to working without Presto?
That's tough. I guess if I had to, I would find a way. I'm pretty adaptable, but it's hard to imagine. It's hard to imagine doing it. I use it, use it 200 times a day. And I think where I would really notice it, I'd notice mostly the fatigue. I'd see my numbers drop, but I would notice the fatigue at the end of the day. And then I would also feel like, am I really doing the best job? Am I really looking at the images long enough now that I've, sort of retrained myself to keep my eyes on the images the whole time?
Now, for a colleague at another strategic radiology practice who's on the fence, what would you tell them?
I would say give it 2 hours And if you commit 2 hours to using it and adjusting your workflow a little bit, you'll be thrilled. It may take just a slight tweak of your template for it to be the most efficient for you. But I think what I would do, really, I would start with ultrasound worksheets. And I think that's what I've done with my partners. That's the first thing I've showed them is ultrasound worksheets. Jump in, do the trial, do some screen captures of ultrasound worksheets, watch it merge into your report, and then I think you'll be sold.